Dr. Pescatore, joint health is an issue for millions of Americans. Can Pycnogenol help with that? Are there studies to support it?
There absolutely
what have
are.
you learned?
I mean, there's great studies to support the use of Pycnogenol in joint health.
Okay.
And again, Pycnogenol being this wonderful super antioxidant that has so many different properties, works on multiple levels. And the studies looked at many different things. So it looked at what's the main thing people complain about: joint pain, mobility issues, that sort of thing. So there's studies
stiffness,
that, stiffness, all of that. And there's an entire index score that's very standardized that they use in clinical trials for pharmaceutical drugs as well. So they use that same scoring system, and in the studies, 40 to 70% relief of symptomatology. And again, it was dose dependent. How long you took it determined on how well your symptoms.
But 40 to 50%?
To 70% in some studies.
Wow.
Reduction in...
That's significant, isn't it?
Oh, yeah, no, the p-values were absolutely significant, which tells you whether it's actually significantly different from the placebo.
All right.
Because they did do these with placebo. Some of these studies were done with placebo controls as well.
All right.
So when you look at Pycnogenol and you look at the fact that it can actually do that, can actually increase your mobility, it can actually... I think one of the studies looked at how far people could walk on treadmills.
All right.
And it increased their ability to walk on treadmills longer over the course of time. And again, the longer you took the Pycnogenol, the better your results were.
Okay.
So I think this is really important for people because so many Americans, will take things for 2 days.
That's right.
And say, oh, it doesn't work.
That's true.
You've got to take it. I always tell my patients, give everything a try for 90 days.
All right.
90 days. If it doesn't work by 90 days, probably it's not going to work for you. But and it showed. I mean, at 30 days there was a reduction. At 60 days there was a reduction. At 90 days, Pycnogenol had a really significant reduction. So that's one way in which Pycnogenol and the studies have told us how it works. The other way is that it's anti-inflammatory.
All right.
It's a natural anti-inflammatory, so
it
works
a
on
natural
anti-inflammatory, working on the same pathways that the drugs work on.
Okay.
So it works on the COX-1 pathways, the COX-2 pathways, the prostaglandin pathways, works on all those pathways that those drugs work on. So it's anti-inflammatory. Third way is that in these studies, it looked at patients using non-steroidal anti-inflammatory drugs, can I mention names? Such as the common ones like Tylenol and
the
Advil
NSAIDs, right?
and ibuprofen. Yeah, the NSAIDs. And it showed that patients who took, the trial participants who took Pycnogenol were able to reduce their usage of those drugs. One study showed up to 80%. I think it was 78%, let me not exaggerate. But it showed up to 78% reduction in the use of non-steroidal and anti-inflammatory medications, which is terrific.
Yes.
Because non-steroidals cause ulcers, they cause
Erosions,
GI
right?
upset, they cause esophagitis, which can lead to cancer. Non-steroidal, it's the leading cause of liver failure in the United States is the use of non-steroidal anti-inflammatory medications, and they are the most commonly used drugs in this country.
And they're everywhere.
The most commonly used drugs
truck
in this country.
stops, anywhere
Of
you
course.
can get them. Yes.
So that was another beauty of Pycnogenol, able to reduce that.
Very good.
To reduce the use of that, and therefore it reduced people's GI symptoms as well. It was really kind of funny how these studies all play out, but when you think about it, they're all related. All of these things are related. And then the other thing, and this is an interesting thing, maybe just for a medical professional, but it really it's a nice way of looking at things. CRP, which is a C-reactive protein level, it's an inflammatory marker.
That's true. Yes.
And it showed taking Pycnogenol reduced the CRP levels in these patients, in these trial participants as well. So it's actually a marker. I like blood markers because it's actually patients can actually see, oh, my CRP level's going down. That's terrific.
A great
feel
visual.
better.
Yes.
It's a great thing to show people, especially if you've got scientific-minded people or engineers or something like that need those. They need something validated. They need it on paper. Oh, just because I feel better doesn't mean anything. I need to see numbers. I need to see results.
All right.
Well, now Pycnogenol gives you one.
Excellent. So it gives you a great visual.
story of what's going on in your body, right?
Yes, I mean that's a marker for what's going on inside, because we always like to have, physicians need some ways of monitoring what's going
they do.
on, and just having relief. While that's all well and good, we also like to see something that's biochemical too. I don't know why, call us crazy, but we like to see biochemical things too. We don't care whether you're feeling better. Biochemical, that'll tell us whether it's working or not. And pycnogenol, like I said at the very beginning, increases joint mobility, and decreases the use of NSAIDs, and decreases the CRP level. Pretty amazing.
Quite a combo, yes.
Yeah, for a natural product.
For a natural product.
Natural product made from a pine tree. Pretty remarkable.
Thank you so much, Doctor.
My pleasure.